4, 5, 6, 7, 8, 9, 10, 11. 11 times 10 is a ventricular rate of 110 as well. So we have a heart rate of 110. We have a regular rhythm because everything's marching out on time every time. Okay? There's one P wave for each QRS complex. All right? Which tells us that it's all of our P waves are upright and look the same. That tells us the impulse is coming from the atria. We assume it to be sinus at a 1-to-1 ratio. Okay? So what we're looking at here would be an example of sinus tachycardia. Okay? Next strip. Are there P waves? Yes. Do they all look the same? Yes. Is there one P wave for each QRS complex? Yes, there is. Okay. The PR interval is constant as well. Okay, so it's taking the same amount of time to reach the ventricles. And again, we said P waves are all upright and they appear similar. All right, so we assume them to be sinus. All right, that's the trick here. QRS is narrow, which confirms what? That the impulse is coming from above the ventricles. Okay. Is the rhythm regular or is it irregular? It's irregular, right? These QRS complexes, notice these big tall R waves are not marching out routinely as we would expect them to. The distance between them is differing. Okay? So this will be an example of what rhythm? Okay? Sinus arrhythmia. Good. All right? It's sinus because we have upright P waves that are coming at a rate of 60 to 100 beats per minute. They all look the same. The QRS complex is narrow, and it's an irregular rhythm. Remember, sinus arrhythmia is the only irregular sinus rhythm. Okay? All right, last strip that we have here. I see P waves present. Okay? They're all upright. They all look the same. So we assume them to be sinus. There's one P wave for each QRS complex. The PR interval is constant, meaning that it's taking the same time for every sinus beat to reach the ventricles. And the QRS is narrow, which tells us or confirms that the impulse is originating above the ventricles. Okay? So we'll go ahead and work through RP and Q times 2 stat. Okay? What's the rate? I see an atrial and ventricular rate of 1, 2, 3, 4 times 10. So you have a heart rate of 40 beats per minute. 40 beats per minute atrial, 40 beats per minute ventricular. All right? Is the rhythm regular or irregular? Well, all of my P waves appear to be marching out on time every time, so we have a regular atrial rhythm. Is the ventricular rhythm regular or irregular? So all of our QRS complexes are marching out on time every time with the same distance between them. So we have a regular ventricular rhythm. We can go ahead and take a look at the PR interval here. Okay, so the PR interval is roughly one big box, so it's we'll say 0.2 seconds. Okay. P waves are all upright. What else can we talk about with this rhythm? RP and Q times 2 stat. We talked about R and R, P and P. QRS complex, is it narrow or wide? It's narrow, okay? If we look here, it looks like there's 1, 2, 3, 4 small boxes spanning the width of this QRS complex, which would be a measurement of 0.12 seconds. Okay, so that's within normal limits. The QT interval is spanning from this solid line to about this solid line, or maybe one small box afterwards. So it appears a little bit longer than it should be, but it's roughly half of the R to R interval, so we're okay there. Okay, what about the ST segments? Here's your ST segment here. Does it appear in line with that PR segment? Is it above the PR segment or below the PR segment? Okay, it's nice and in line. So the ST segment is okay. There's no elevation or depression. Finally, all of my T waves are nice and upright. Okay, so what do we call this rhythm? We have a regular atrial and ventricular rhythm, P waves that are upright, coming on time every time at a rate of 40 beats per minute. This is an example of sinus bradycardia. Okay, good. So that wraps up the sinus family of rhythms. Next up, we'll start to look at, dive into the atrial family of rhythms and arrhythmias, and we'll discuss more a term that we introduced back a couple slides and videos ago, which is ectopy. So we'll start to look at ectopic rhythms and ectopy and premature atrial contractions, in addition to some of the rhythms that you see here on the screen.